is counting, and it is counting. So very excited, and I'm a big fan of today's guest, Dr. Ryan Peebles from Core Balance Training. Dr. Ryan, thank you for coming on today. We're going to have a lot of fun, I think.
Thanks for having me, Pete. I'm excited to be here.
You are an expert in the back. You're a doctor of physical therapy, but you're the back and the hips. And one of the reasons that I took your online course and found tremendous relief from it and helped me physically and helped me get back to playing through the trials and tribulations I had. And we'll probably touch on some of those today since there's such a litany of them. But as the back is really the number one injured area for golfers of all skill levels, of all ages. I was like, God, I got to reach out and see if he'd like to come on the show. And then that was a couple weeks ago or months ago, and talked to your sister and got it arranged. So here we are. So very excited about this episode.
Yeah. I do know this about golf. I'm not a golf player myself because, my back problem started at such a young age that I kind of made a conscious decision, and it was pretty bad. You'll hear some of my story maybe today. It was pretty bad. And I had to make decisions like, maybe I shouldn't be a golfer because I already know it's tough on the spine. But I played baseball a lot, and there's some similarities in the swing. And I have played my fair share of golf and watched some, a lot of the Masters. Me and my dad like to watch. So I'll be able to speak unrelate back pain to golf through this.
Well, if anybody watches, and you have a very, very thorough and educational YouTube page that obviously we'll link to that in the summary and all your social media, but a lot of people can pick up a lot from that. But even someone like myself, I would consider myself a amateur trainer because I've been studying it so long. I tell you where I got not to get into my history at all, but just to give you some context. And I was always big into training. And the first time I had a back irritation through golf, Health South had the contract with the PGA and the PGA Tour. That's going back. They got in their financial trouble and they had their issues, and obviously both entities moved on. But was always fascinated because when I was a kid, I was like sophomore in high school. I think I was 6'3", 170 pounds. I was a beanpole. I could never put on weight. Now the wind blew and I lost my balance. So I was fascinated by weight training, and when I got into it, like most guys, once you start putting on some muscle mass, it's like, wow, this is great. And of course, as you and I talked before the show, that led to some more irritation of an issue that I had developed at a young age. Had found through Gabby Reese did a show, Art of the Athlete. I don't know if you ever watched that.
I haven't.
And well, what she did was they would go to various athletes. The Machado, one of the Machado brothers that was a jiu-jitsu world expert.
Yep.
Ryan Moore, who was a PGA Tour player. The one guy, he just retired a few years ago from hockey. So Chris Chelios. And what she would do is she would spend a day or a few days with each of these athletes and go through, what do they, how do they train? How do they do their therapy, their preseason, post-workout, post-game or whatever. And she was interviewing her husband, Laird Hamilton. And at this point, I thought I had known quite a bit about training and things like that. And then she said, well, what do you do for your diet? And he said, well, anything Mr. Check tells me to do. And then I got into Paul Check. And so I Googled him. Who the hell is Check? And I look at his website. I'm like, holy shit, this is amazing. It was so in depth. So that was the first time I got introduced to holistic alternative type things. And, now that seems to be going to the norm, where back then it wasn't. But I don't know where the hell I'm going with all that. I guess just to give
you were saying you've picked up a lot from your own, personal journey, and you could be an amateur trainer yourself.
Yes, not that you've done that. You have your experience with injuries, and you have education in it, official education, where mine is just reading internet videos.
Well, I'd say there's a lot of similarities between our story, because I actually got the education later, when I realized that I had actually figured something out about the body. And I had spent a lot of time, educating myself just on a personal way to help solve my back problem, which took a lot of my life away from me, because I was pretty debilitated for a while. And at that, when I knew I was onto something and I was getting better, which doesn't happen for a lot of people in chronic lower back pain, usually you get worse. I really felt like it would be best for me to get some credibility and like get some education and like get official, because at that point I already knew I was on track, but I was just a guy with a bachelor's degree. So then I went to PT school, and that was a really unique experience, because I don't think a lot of people get to do this, but I went through PT school with basically a single track mind focus about how do I learn everything about the spine, because I already know I'm trying to make a dent in this back pain epidemic. And so I was really hyper focused on learning about back pain and the spine as I'm going through school, where all of my classmates are like, should I be, what I'm trying to figure out where I want to emphasize in. I was dead set on the spine already.
It's amazing what that kind of debilitating pain, the focus it will develop just
Oh
from
yeah.
wanting to not ever have to go through that or watch people have to go through that. The amount of motivation it can create.
Yeah, it was immense, and I think the other factor was just the passion that I wanted to get back to, which was surfing. I was obsessed. It was my identity, and I do relate that a lot with golfers. Golfers and runners are ironically another one that just feel so passionate about their sport. And yeah, that kind of motivation was the motivation. It wasn't just to get out of pain. It was to be able to do the life that I want to do. It was the function.
Hmm. Have you gotten? I'm assuming with how you've helped heal yourself that you're back to. Well, you've got kids now, so your surfing might you might have another
Yeah.
anchor on your ability to
Let's
get
just
out
say
there.
some of my surfboards are collecting dust. I still get out there ideally weekly, but because I'm lucky enough to live by the ocean, but it's tough. Yeah, it's tough.
If I can, when we're done, if I can find it on YouTube, I'm sure it's on, everything's on YouTube. I'll send you the link to that when Gabby Reese had Laird on him because the surfer, I'm sure you would
Yeah. Oh yeah.
really enjoy that.
Yeah, for sure. Absolutely.
His training methods are crazy. I'd love to go there, as I'm sure many would if
Well,
anyone ever
he's a
watched it.
guy. So, I mean, and he talks openly about it, that he's kind of got an addiction to adrenaline, I think. And so a lot of the stuff he does is high intensity adrenaline producing stuff. So his training is going to be like that. He chases the big waves. He's older now. I'm not sure if he's still chasing them like he used to, but he used to be one of the, most renowned big wave surfers in the world.
As somebody who's had spondylolistheses, I want to make sure I get the
Yep,
right one
that's
because there's
that's
three of
good.
them. Golfers are often told if you have a back issue, one of the best things you can do is swim. And since we're on the topic of being in the water, I wanted to touch on that because I know that you've had a number of videos, at least I've seen them. I don't remember if it was in your subscription or if it's on your YouTube or a combination of both, but I found it interesting that when I was younger, when I was in my 20s, when I was in college, I would swim to stay busy because I was in the northern part of Michigan. When it's 10 below outside, you really can't do a whole lot outside, and did get some relief from it. But as I got older and I tried to get back into swimming, I found that it was more irritating. So
Yep.
can you touch on that because I know a lot of
Yeah, for
golfers
sure.
are told to do that.
So swimming is it's a super healthy activity, and it's also a really complex thing to do for the body. And I kind of compare it to yoga, where it's healthy for your body, but it's most healthy for healthy people. And it's really good for posture, bringing the body back into balance. But if your body's at such a stage where, like, there's this threshold where you are totally out of alignment, it can actually cause more damage than good. And so you need to have a certain, like, minimal, like a prerequisite level of just body fitness and health and just joint alignment for it to be actually good for you. And I mean, I think that's a pretty high level to have. And so that's why a lot of people, it's really easy to use yoga as an example, because a lot of people with back pain go do yoga to help themselves, but they end up hurting themselves.
Mm-hmm.
And I think swimming is a really similar thing, because it is taking the body into an extreme position. You're not just perfectly straight like a board. You are actually having to breathe the oxygen. So you're having to do some rotation, and you're having to extend a little bit. And if you don't have a good core stability and lumbar spine support, where the forces transferring from your legs through to your upper body are being done efficiently with that core stability, then it's going to cause some wear and tear in that lumbar spine and other parts of your body too. It's just going to find, it's going to find the weakest link in your body. Swimming is,
Hmm.
and it's going to irritate that unless you have a certain amount of ability to support those joints and stabilize them.
That was, I mean, after watching your videos and learning about that, then because I was wanting to do something when I really had an irritation about last year. You get, when you're so used to being active and then you have to stop for 3 months or 4 or 5, 6 months, whatever, you start to go stir crazy.
But yeah.
And I think that's might have been when I found your information. So I guess that you learned there's a setback and then you learn something from it. So it led us to where we are today. At least it's good for me. I don't know how good it is for you.
Hey, they're all learning opportunities, and there's those certain type of people that take them as a learning experience. Sounds like that's the way you are, and it's the best thing we can do. I mean, you come out of it smarter, and then you get to keep that wisdom with you. So, yeah.
One thing that I learned from yours was I tried to have a focus on not having as much extension, because if you have a spondy, that's one of the worst things that learning your info that you can do, and having trying to stay somewhat in flexion while you're swimming, which is probably impossible.
Yeah,
But
unless you're
doing that,
wearing a snorkel, which you
yes.
can do.
But I tend to get, based off my issues, I tend to get very tight in the QL and then into the right hip. That the all the musculature, and we don't even have to get into that. There's so many. But when I listened to your information, or at least followed your guidelines, if you're going to swim, try to do these things, and did that, at least I was able to get some stretch out of my issue. While I couldn't do really much anything else outside of walk, I wanted to do a little more physical activity exertion. But it helped me. I found out as I get older, as I said before, I'm 52. I found out it's sometimes it's the little things that you can make adaptation to that make a big change.
Yeah,
That being one
yeah.
of them.
Yeah, especially, for people who have a spondy, and they're a lot more common than I think we actually realize. So for anyone wondering, a spondylolisthesis is just it's an instability in typically the lumbar spine. And so it's, people use the common term slipped disc. It's probably the closest thing to that. A slipped disc is not actually a real thing, but if it were, it would be a spondy, where vertebrae is kind of sliding on another one. And so with that in particular, and other ones too, like stenosis, you can make a little change to things that you're doing and make it go from being bad for you to being good for you. And so, for example, for both spondy and stenosis, which a lot of people know they have stenosis, is one of the most common back pain diagnoses. If you're going to go to look up, I don't know, say you're looking up at a bird or the sky, like a monument, you're sightseeing, and that little bit of extension could irritate your back. But if you just squeeze your glutes, squeeze your butt, and just kind of lock in your pelvis into a posterior pelvic tilt, that extension can then go through the upper part of your spine, which actually would be good for you. And so that's just a tiny little change, and you can apply that to other things too. Is it could be as simple as drinking a glass of, the last of your beer or whatever. Those little bits of extension, we don't really want them to go into the spondy, because that's how it got there. That segment, with back pain, there's usually going to be one segment that's taken the brunt of the movement and the force and the rotation. You can think of a golf swing too, like, it's a issue of not uniform movement through the spine, but there's one segment that's doing way too much, and then probably a stiff couple segments above it that aren't doing enough. And so you learn to do a little trick like what I just described to lock in that one segment, and then you can get the rotation or the bending to go through the stiff ones, which becomes good for you.
Stenosis is the inability for the vertebrae to move because of maybe they're out of alignment, or swelling or herniation of a disc protruding into the
The
canal.
way that stenosis is typically defined is the narrowing of the spaces called the foramen between the vertebrae. What you described is, I wouldn't actually describe stenosis that way. That might be a different diagnosis. But yeah, it's just narrowing due to, there's multiple reasons, but you think of the vertebrae, the spine, and there's space between each vertebrae, and that's the discs, right?
Mm-hmm.
The discs are the space. As the discs degenerate and become thinner, that will narrow the space between the vertebrae. Or posture can do it if, say, you're in a severe anterior pelvic tilt. A lot of people with back pain are kind of living in an anterior pelvic tilt. That is going to push the back of the vertebrae up. You're going to rotate something, the spine is going to react, but one side of the spine is going to become more concave and the other side will be more convex. So that can kind of pinch up the back of the vertebrae and cause stenosis as well. And so the problem with that is there's nerves and blood vessels coming out of those spaces, those foramen. When they get too narrow, there's not enough space, and you can get sciatica, you can get just other type of pain. Disc problems can occur. You can get bulges and stuff like that.
Would that be a precursor to having a spondy? And just for the spondylolistheses that we're discussing for everybody, it's and I'll explain. You correct me if I'm wrong. Obviously, you're the
Yep,
expert.
go for it.
I'm just an amateur in this. I like to think I know a little bit enough to be dangerous. But if let's say somebody, just so if anyone's listening, they're driving or wherever you're listening to this, if one vertebrae slides slightly forward to the front of your body, so people don't know the vernacular, the medical vernacular, one vertebrae slides forward, and as it pushes down on the disc has a tendency to get compressed and can slot and herniate out the posterior side or the back side. Did I have that correct?
Yeah, the discs are always going to be impacted by, every condition of the spine is going to be is going to impact the disc in some way. Spondy is generally referring to the movement of the vertebrae, but
Okay.
and so when people talk about spondy, it's like, all right, L4 is sliding forward on top of L5, and that's not good. It's not, the spine's not in alignment anymore. They should be stacked, pretty much stacked. And when they start sliding forward, they talk in millimeters. That's 5 millimeter, anterior slide, then that's going to create problems. And yes, you're right. The disc is going to be affected. It's either going to bulge or it's going to tear or it's going to degenerate. A lot of spondies are unstable. So it's not just that it's slid forward and it's staying there, but it'll slide forward and back and forward and back and forward and back every time you take a step. Some spondies are so unstable that you can't even take a step without it moving. Others, it might be, the end of your golf swing causes that shift in the
If you go into
vertebrae.
extension.
Yeah, like the follow through. And so there's all different degrees of it, but the disc, when that vertebrae is shifting like that, the disc is experiencing, wear and tear every time. So especially in the lumbar spine, we want to be stabilizing that. We want to find a way, with our own internal muscles, right? And sure, you can use a brace, but that's not really a recommended way. Find a way to lock that in. And that could be a strategy, like what I was talking about before. You lock in your pelvis, squeeze your glutes. Probably doesn't work very well on a golf swing, or it can be through training and restoring, muscle tone in all the muscles that surround your spine.
Golfers over the past, I would say 20 years through the training, obviously Tiger had brought it to the forefront, being the weight training in particular. Obviously, if you go back many decades, Gary Player was obviously very fit. I think he's 90 some years old and still playing golf. But golfers were never known in the 70s, even in the 80s, to be physically fit.
Yep.
They go to drink, they go smoke after a
Cigars.
round.
Yep.
Yes. Tiger kind of brought it to the forefront for the masses.
Mm-hmm.
Maybe too much. Now they're in Olympic lifting, and that's probably not the best for many of them. But as far as, so they're very familiar with the core, but core balance training deals with the deep core. So can you elaborate on that so does people get a better
idea?
For
sure. And I can also relate it to golf as well. So the core can be defined in different ways, but when most people think about the core, you're thinking about your abdominal muscles, and the visible abdominals are the six-pack abs.
Mm-hmm.
And you get the muscles on the sides and the back. Well, there's actually not, it's not just front, sides, and back. There's actually layers that go deeper. And the deeper you go into the layers of the core, so the deepest layers, the purpose of those muscles become more and more for just stability and less designed for creating movement. Most people think of muscles as their job is to move the body. Well, that's right. But there's another purpose of muscles, and it's to create stability when we need it. If something needs stability all the time, it would just be bone, right? Or
Hmm.
if it just needs to be a structure. But certain things need to be able to move sometimes, but at other times they need to be locked in. And so that's what these deep core muscles do. They're shaped exactly like a corset brace. And so when they contract, they're broad, and they don't really do anything except hug the spine and lock it in, so that, like, when if we apply it to a golf swing, when you're getting that rotation through your hips and your pelvis, that energy transfers up through the lumbar spine efficiently because it's stabilized and goes into the thoracic spine and the arms and transferring into a powerful swing. But if those muscles aren't functioning right, if those deep core muscles aren't just locking in the lumbar spine by squeezing it, then some of that energy that you're trying to generate through your hips in the swing is going to get lost into movement in the lumbar spine, which is both bad for your swing and also bad for the lumbar spine because it's not designed to rotate. The lumbar
Hmm.
spine really shouldn't rotate. The thoracic spine is designed, like, the anatomical structures of the thoracic spine are much better for rotation, and the lumbar spine should really only have 1, maybe 2 degrees at the most of rotation. This is basically zero. And so that's not the type of movement that it's meant to be doing. A little bit of, could be doing a little bit of side bending. And I know a lot about a swing because, as I mentioned, I played baseball. Played quite a bit of baseball. There's a lot of overlap between a
Hmm.
baseball swing
Quite a bit.
and a golf swing.
I've had Blake Austin is a hitting coach out of Atlanta that played for the Braves. He was on. We had a whole segment on baseball golf relationship and training for
Yeah.
each. So
I'd
yes, I
say,
agree.
I mean, the vast majority of the mechanics are the same, and especially as you really need to be generating the drive through your hips and
Hmm.
rotating your entire pelvis. And the big differences are just like the abruptness. A baseball swing is much more like, where a golf swing is much more fluid and smooth, and you're winding back. You have the time to do that, where in baseball you're reacting to a 100-mile-an-hour pitch.
Hmm.
And so it's much more explosive in a shorter period of time sense. And but the mechanics are really similar. And I think this is one of the contributing factors that screwed up my back. Was I did not know how to rotate through my hips. And I had a hitting coach. I had a hitting coach who was an ex Dodger, and I just remember him trying to get me to rotate through my hips, like grabbing my body and being like this, and it just did not transfer into my brain, and I never really figured it out. And I was a big guy, and I would hit the ball at the right spot with the right part of the bat, and it just wouldn't go that far because I was generating drive through rotating through my lumbar spine.
Mm.
And that is not where you get drive.
Mm-mm.
I was all upper body with my swing. And I think that was one of the problems. And I would imagine that there are some golfers out there that are doing that too.
Yeah, you combine the anterior tilt. So for everybody, if your pelvis was a bowl and you tipped it forward, that would be anterior, so tilting towards the front. And that now you combine, so you're that. So as you mentioned with stenosis, now the back part of your spine gets compressed, and now you add rotation to
Oh
that, and it's
gosh.
just a recipe for something to just, you'll hear that pop or that snap or that blowtorch on the back, and next thing you know, you're on
Yeah.
your knees and you can't move.
And my understanding is they do say you should have some anterior tilt in a golf swing, or at least that's how some people coach a
Some
swing,
people
right?
coach that. It hasn't become a debate in the coaching world yet. There is some more more coaches, instructors that are leaning towards getting your forward, getting a little bit of forward bend, but getting it more out of the thoracic spine, and don't stick the rear end out and up, which would tilt you more. That's going to put more strain in the lumbar spine as you're going to put it through the torques and the forces. As you get into the better players who are swinging 120
Yeah.
plus miles an hour.
I think if you were to dive deep into this, and I spend so much time on this that I can just visualize it in my head right now. But if you were to go deep into anterior pelvic tilt in the golf swing, there's a way you can do it, and I know why they're anterior tilting, because you want the pelvis to rotate in that plane. If you're just
Mm-hmm.
standing straight up and down, then the rotation is not happening in the right plane, right? That's more like a baseball swing. You're swinging sideways. Golf, you're swinging at a downward diagonal. And so you want the pelvis to be in the same plane as the swing. But what you can do instead of anterior tilting, which compresses the lumbar spine, is you could actually just do a hip hinge. And so in a hip hinge, your pelvis is rotating forward, but so is the things above it are going with it. So your
Mm-hmm.
spine is going with it. And you would probably have to do a little bit of a weight shift to, you'd have to find the right center of gravity to be able to do that. But I think it would be a lot better for the spine, at least for people who are, not trying to win masters and are also trying to look out for their body. There might be a way to do it and not pay the price for it.
Well, I think it's gone to more, at least what I'm seeing and talking to, I go to the seminars and I go to the forums and I go to all these PGA shows last month. And it's back in the 80s and 90s, early 90s when I was coming up and was an apprentice and things like that. They used to tell you, hinge from the hips and then put your rear end up and back like you're trying to get up on a bar stool that's too high, which was obviously the
Yeah, that's
anterior
the
tilt.
rotation of the pelvis.
Yes, and now it's gone to hinging from the hips, as that has become more prevalent from people like yourself who are getting out there more, and all your information and all the, as we talked about Dr. Stu McGill in the pre-show, his info, he's big on hip hinging, and if you go down the line of world-class experts who either do the research or are working on these things all the time, it's the hip hinging where now you get filtered out, some of the information gets distorted, and now they're saying, well, tilt the pelvis and hinge, which is, as we've just discussed over and over, that's going to be really, really, that's a
Yeah,
ticking
that's
time bomb.
essentially winding up the spine. And, personally, I wouldn't do it for myself, but if my entire livelihood depended on it and I didn't have a chronic back problem history, then that's the only situation where I would consider doing it. That just knowing the biomechanics of the body. And then, as we said, you're adding intense rotational forces to that. The lumbar spine is not designed for that.
Yeah, and then you throw on top of that, if you're right-handed, you've got right side bend. So you're anterior tilted, you're torqued, so you're rotating, and then you're going to bend it to the side. It's like every possible
Yep.
angle in biomechanics, you're
Yep.
putting torque through your spine. It's going to break at some point.
But the big point is, I think it doesn't have to be that way. And you can still have a really good golf swing biomechanically. The lumbar spine, in the most efficient golf swing, the lumbar spine wouldn't rotate at all.
Comes out of the hips, right? It's a
Yeah,
rotation
the
of the hips.
hips and the thoracic spine, which are both designed for a lot of rotation.
Mm-hmm.
Like the thoracic spines can do like 45 degrees of rotation, where the lumbar spine, if you put all the segments to get together, might do 5. But
Max.
we can be over rotating through the lumbar spine and going beyond what's anatomically supposed to happen. And
Mm-hmm.
that's what I was probably doing with my baseball swing, and just grinding essentially my L5S1, which, if you look at the MRI, it looks like it's, think the crab meat in the sushi that you had. That's kind of what it looks like. So yeah.
But your program, the core balance training that I took the program, it's at least 3 months, and it's very affordable. Anybody out there, in particular, if you're suffering from back issues and run the gamut, you've gone to your local trainer or therapist, whoever, and you want to get back to playing, or you want to get back to lifestyle, you want to pick up your grandkids. What I found amazing about it was, as we talked about, that you've got the deep core versus the core, as you already mentioned, the stabilizers all the way down, the smaller muscles underneath as they're layered. some of the things, and you offer a 7-day free trial that people can find out what we're
Yep.
going to talk
Yep.
about.
And
But
just check it out.
it's amazing that in a world full of technology and measurements and all these things, AI, Chat GPT, I mean, the list is endless. That I prefaced earlier that all my background in this, obviously, I played professional golf and I studied Czech and Poliquin and Mel Siff and all these people. But you read all these things and you get going down such a in these rabbit holes. But some of the most influential things that I found was some of your things in the first phase. That some of the most basic, simple things are just sitting on a chair, a firm surface, not very padded, and just decompressing your spine. So can you get into, not without giving all the way your program, because we want
No,
people
I
to
mean, I
please check
can
it out.
talk, I can give it all away right now because it's not really the value in the program is not verbal information. It's actually the guidance of getting down. I think the gap that we fill is introducing people to the feeling of core engagement.
Hmm.
I can talk about it all day long, and that's what I'm here to do. So yeah, the real magic sauce of the beginning of the program is that we're teaching a super healthy way to stabilize and engage the muscles of the lumbar spine. That's the foundation of the program. The program goes on for 10 more modules, but really those 10 more modules are just adding layers of movement, different types of movement to those foundational first two modules of learning how to like get familiar with a healthy core engagement that stabilizes your spine. And we break it down so far that it's hard to compensate. It's hard to do it wrong because each step, as it takes 4 days just to teach the basic
Hmm.
bridge exercise, because we're breaking it down so much. We are really sure that you're doing a healthy core engagement. And then we add movement to that. Very simple movement in the beginning. And then by the end of the program, it's complex movement. But nothing has changed to that foundational stuff that you're talking about, which was extremely valuable. We're just preparing you to go out there in the world and do things that with a healthy support for your spine that aren't going to hurt your spine.
Well, I think for golfers in particular, one of the biggest things is rib flare,
Mm-hmm.
where the ribs will the for everybody out there, that's where the front of your ribs are lifting up higher. It's like you're popping a wheelie with your ribs, in particular in the as a impact to the follow through in the finish position. And I don't remember, it was in the third or fourth step of your program that you teach everybody how to lay down on the ground and where to engage and where the pressure points are. That I want to, hopefully we'll get into the 3 points within your program that seem to be the base fundamental, if that's fair to say. But to get rid of rib flare, you don't realize you have it, especially if somebody's playing a lot of golf. Like in our area, we have a lot of retirees. They're playing
Uh-huh.
probably 3-4 times a week. If somebody's playing in college or they're playing junior golf or they're playing professional, they don't have an understanding of how much their ribs are flaring because it's happening subtle over time. Each swing, it's going at maybe a hundred or a tenth of a percent more. So I'll step out of the way and let you discuss the rib flare and the importance of why bringing it back down to uh, getting rid of that flare is so important to allow the lumbar spine to then be in a better curve and not too much lordotic.
Yeah, exactly. I mean, you said it really well. And so the rib flares is a sign. It's a sign. And if we see it, then we know that there is a bit of a disconnect in the abdominal core, because what's allowing the ribs to flare is lengthening of the abdominal muscles. And there's 4 layers of abdominal muscles, just for everyone wondering. We got the deepest, the transverse abdominis, the internal oblique, the external oblique, and the rectus abdominis. And so all of those muscles attach to the bottom of the rib cage in the front. And they're like, basically think of like a rope or a net that comes down and attaches to the pubic bone. And so if that net gets stretched out, then the distance between the pubic bone and the rib cage increases, and the rib cage starts to flare up. So it's just a sign that we can see. It doesn't mean that you have symptoms. It doesn't mean that you have anything that's an existing problem, but it's not something you're going to see in a healthy 4-year-old child. They haven't had time for their posture to get screwed up yet. It's not the way that it should be. So we see this as a sign, especially if that's combined with symptoms like back pain, which often it is. Then we kind of know where to go. We can see that the predictable pattern of muscle imbalances, as I like to call them, is occurring here. And so there's more muscles involved. The abdominal muscles don't work in a vacuum. We've got the lower back muscles, and in this predictable pattern, they are usually tight, overly tight. And hip flexors are also overly tight. But then we have the glutes. They are similar to the abdominals. They tend to get lengthened and inhibited is probably the most accurate word for various reasons. We sit on the glutes all day. Try sitting on your bicep all day and then go and use it. It's not going to work quite as well, right? And so all these various factors that lead to issues like rib flare, like anterior pelvic tilt. And so what we want to do is try and reverse this pattern. We're not just trying to look at the rib flare in a vacuum and say, just bring your rib cage down. Well, that probably is going to lead to another compensation elsewhere, like maybe hunching forward, right? You can lower your rib cage just by hunching your shoulders forward. And so that's how we're going to tie this now into the 3 anchors that you brought up. So the system in core balance training that we use to teach healthy core engagement has 3 points that we call 3 anchors around the core, front and back, that are essentially check and balances for each other to make sure that compensations aren't happening. And so one of them is the bottom of the rib cage in the front. And we're going to anchor that to the pubic bone, which, guess what, is another one of those anchors. And so by anchoring those 2 together, we are bringing the rib cage and the pubic bone, we're shortening that distance. And so that's essentially, we're going to relate that back to the abdominal muscles and the net that was getting lengthened or stretched out. We're actually bringing some more tone, some more tension into those muscles, which happen to support the spine. And so, but you could do that with the compensation of hunching forward or slouching or whatever. So we have a 3rd anchor in the back called the back anchor. And it's essentially the thoracolumbar junction. It's where the thoracic spine and the lumbar spine meet. And so basically, if we could show a picture to you right now, a person would be facing sideways. So you're looking at a side profile of somebody, and the 3 anchors form a triangle around the core. And they all work together to kind of frame the spine into a nice, neutral, healthy posture and prevent the way that we use the anchors is we push away from them. And I'm going to get too deep into the weeds, but they prevent us from using compensations to make the connection between those 3 anchor points to make a triangle.
Well, I think that's why in doing it, what I realized is because as I was reading it on your website and watching some of the YouTube videos, I'm thinking to myself, well, if you have a rib flare like I do, and you have the front, all the muscles in the front of my spine, obviously from so many years of playing golf, are stretched out. The tonic versus fascic, one side is too tight, one side is too loose, and then the muscles on the back side of the spine, obviously, as they're looking to stabilize, are getting too tight. So it's like, well, how the hell am I going to do this? How am I going to tighten the front? Because like you said, if you bring your rib cage down, and anybody out there listening now, whether you're driving in your car, sitting in your office, supposed to be working, or wherever you're watching on YouTube, wherever, if you bring your rib cage down, like you said, you're going to lean forward.
Mm-hmm.
And as I was watching this, until I went through the program, and like, laying on the ground, where you have a flat surface that's obviously very stable, allows you to have the sensory function of your brain and your body, proprioception, allows you to figure out how to do this with something that it can relate to that's stable.
100%. I love that you brought that up, because this is the gap that I think that core balance training is filling, is getting you to feel. It's just guiding you to feel the feelings, because describing it in words, it can't do that. It
Hmm.
we need to have the familiarity, and especially because, I could describe you how to do a deadlift in words, and then you could probably go do something similar to a deadlift. But with what our goal is with chronic back pain is to support the spine all day long, not just for a 5-second movement or lift. So you really have to have a familiarity and a confidence with the feeling that you're trying to sustain at a really low level, that you are engaging when you are doing the dishes or brushing your teeth or doing low level things. And so it does take a lot of acuity to, and or just body awareness to, and familiarity with what you're doing to do something at a low level, like
Hmm.
really low intensity. It's easier to feel things when you go 100%. I'm just gonna, like, lift a super heavy weight. I'll feel that. It's easy to feel, but turn it down super low. You're not gonna. It's like Shaq trying to shoot a free throw, right? He can't feel the ball. It's hard to do, right? And that's what we're trying to do with our spine. It's not sustainable to engage heavily all day long. You can't sustain that. Maybe it'll support the spine, but you're not going to last. And so, yeah, the ground is the way to, this is the training ground for developing the feelings and getting familiarity. And this is really just being modeled after how all of us originally developed our core, and the healthy core engagement that we all started life with, because we all started on the floor and we pushed away from these support points that we have just modeled core balance training after. And babies and infants develop their core in a very healthy way without ever learning what a muscle is or how to contract it or anything. They're just pushing away from the floor with the goal of getting up off the floor eventually to walk around and be like everyone else. And they're pushing away from these specific support points. And by the age of 4 years old, a healthy child will have perfect posture and movement without ever being trained on how to do that.
Yeah, my niece, let's see, she's 5.5, a little older than that. But when my brother brings her over and she'll drop something on the ground, and we've noticed this for years because we obviously both try to train as much as possible. Her squat is absolutely perfect form,
Yeah,
and it's
it's
like no
stunning.
effort whatsoever to pick her puzzle piece up off the floor, and it's like down, up, down, up.
Yeah.
Oh, I
I
wish I
look at
could
my
see her.
son do it and I'm like, damn it. I train for this. But yeah, we go through life, and just we get to do a lot of fun things in life, and our bodies take a toll, and it is what it is, I guess.
The what I have noticed after, again, I did the 3 months and I continue in your alumni program. So everybody out there, it's not just his 3 month program that you go through. You can stay on as an alumni, which is a kind of cool way to
Yeah, cool.
term it. The doing it on the ground, it gives you a target or a base to say, okay, here's where I finally should be. And it takes a little while. It takes a few days, maybe a few weeks. Well, for me, it probably took 2 weeks before that I could get on the ground and my ribs wouldn't be flared just through life. And as I noticed driving, I was in the car for 12 hours yesterday and 5 hours today. I noticed that I would catch myself, especially after 5, 6 hours of sitting in the car, I would find my chest collapsing and my forward head posture pops in. I'd have to get myself up. But where I'm going with this is after learning what proper posture was by laying on the ground and getting the rib flare down and having an understanding of what the spine should feel like, relaxed yet still engaged at some level. When things like that happen, or when I'm at the PGA show and you're walking 15 to 20,000 steps a day and your back is starting to irritate you. Years ago, I used to just try to squeeze my glutes and try to stand up straight. Now I can bring my rib cage down. I have something to go. I know where the target is. I know what it's supposed to feel like. So I can try to mimic that best I can, given the fatigue. If when you're standing on your feet all day, or when you're sitting for hours on end driving, halfway across the country.
Yeah. And the taking a couple days or even a couple of weeks to really get the feeling is about right. And personally, after being in this world for so long, I think that's pretty fast.
Mm-hmm.
because, a lot of us have been in an unhealthy pattern for a decade or more, even before the pain started coming on. Everything that I'd say a really high percentage of back pain is just gradual onset, slow, repetitive trauma that's been building up in the background for a long time. And then you go to lift something up one day, and it could be a toilet paper roll on the ground, and your back goes out.
Or you sneeze.
Yeah, right. And sure, you could blame the toilet paper roll, but the reality is that it's been building up to that for a long time, and potentially for even decades. And so to be able to reverse a pattern in the body that's been going on for that long in 2 weeks, I think it's really fast. And it's not like it's permanently reversed, but at least you've broken a movement pattern. It's
Hmm.
like breaking a bad habit. It's a hard thing to do. And so that's, why we do start off just in a really controlled environment, laying on the floor. And I even say, like, it should be kind of a quiet place where you can pretend you're meditating on this and spend 5 minutes doing this. And then, you start to add in more complexities as you go to try, and now we're going to try and mimic the real world. All right, we're not going to be laying on the floor to be able to do this. Eventually you got to get up off the floor. And so we are trying to groove new movement patterns that become, ideally, but this might take a year or longer, become your actual movement pattern, that you don't have to think. We always have to think about our bodies, but you might not have to think every step of the way through it.
Yeah, it makes total sense. It's like the body wants to be equilibrium, homeostasis, like the medical, to go to takes the term out of medicals. I didn't go. I wanted to at one point, but I said there's no way I'm staying in school another 8 years. That wasn't going to happen. Four was plenty for me, especially when you're in northern part of Michigan. But I think that there is a non-conscious portion of the brain that seeks out to be where it's in its most equilibrium and not, or most efficient state. And obviously when you're out of alignment, whether it's your lumbar spine or any other joint in your body, that the brain has some sort of, I'm not going to say there's a cortisol release, but there's some sort of antagonizing of something in the non-conscious that's saying something's not right and it needs to be fixed. And I noticed that with when I work with some students with their golf swing, they've been trying to do something in their swing that they're just not physically built to do, and I'll make the adjustment. I'm not saying I know everything, but it's something that's quite obvious to me. And I say, here's what we're going to change, and they do, and they very quickly they start to hit the ball much better. And they said, how did this happen? I said, well, you've been trying to do something that you're biomechanically not able to do, and
Uh-huh.
all I did was make you do it. And they said, well, how long is this going? I said, well, you might have some residual because you built a pattern for so long, but I think the more you go back to the fundamental of how you got to this, in using an analogy for your program, somebody gets on the floor, they slide, they bend their knees, their feet are flat, and then they just allow themselves to deep breathe into their lower back, allow their ribs to settle down. And then now they, oh my God, that's what I'm supposed to feel like. There's no
Yeah.
more strain. There's no more, it's like my brain, not only my body relaxed, but my brain relaxed when they do that.
Yeah.
And it's like someone like what I'll do sometime when I'm out on a lesson tee is I'll grab some sand from a divot or some dirt and I'll sprinkle it on their shoulder. That's the magic dust that you're now going to hit it really well. But that's an analogy that I've come up with in working with some players, and then doing some of the most basic, simple things in your program that have had a dramatic effect for me. Not even the advanced stuff, because some of the advanced stuff I had done through, like the airplane,
Yeah.
which I'm terrible at, a one-leg
Yeah. You've
airplane.
made it all the way through, it sounds like.
Yeah. Yes. I always go back to the first things that seem to really, when I know my back is like, it can twing or twang or whatever you want to call it,
Yeah.
and I could be locked down for a little while. I'll go back to, okay, let me sit up. Let me get on the dining room chair that's wooden. Let me get real straight and just deep breathe into my lower back. Now let me get on the ground. Geez, there it is. My ribs popped up, or it's crooked, or this or that, and it's like, okay, everything settles down again. It's
Yep. And spend some time there. I'd do it too. If I did the car ride you just did, I can guarantee I'd be getting down on the floor, like, at least the very next morning when I wake up, and just spending, man, if you go good 15 minutes just doing that spinal realignment that the floor does for you with the breathing and the engagement. And then you get up and walk around, you do feel lighter. And I
Mm-hmm.
think that's one of the things you were trying to describe earlier is like the body will give you signals, when it's not in homeostasis, there are some form of alarms going off, whether it's pain or just some kind of buzzing or just like you can just feel it intuitively. And then when you correct that or bring it back towards that equilibrium, you get this feeling of like the nerves are flowing better or the lightness. And I get that from just getting down on the floor for a little bit, spending some time in that healthy position. And you get back up and you're just like, man, I really should do that more often.
Mm-hmm. Well, one question I'd like to ask you is the front anchor where you're laying on your stomach.
Yep.
Because anyone that has watched or will watch some of your videos on YouTube, hopefully thousands go to it. They flock to it from this episode. The front anchor, when I did those, and I'd gotten very confident in what I was doing in your program because I got so much relief. And I'm like, well, I know that whenever I did any Superman or extension exercise in the past, like a prone cobra, it didn't feel good. And then shortly thereafter, it caused me some problems. And I'm thinking, well, should I do this front anchor exercise? And it's more of a struggle for me to do it than the back anchor or to get the rib flare
Yeah.
down. But I was very nervous when I started it, although it did give relief. But it was for me that position, and anyone that's had spondy, lolistheses. I want to
Yeah.
make sure I
You can
got
just say
that right.
spondy. Yeah.
Okay. If they have fear about that,
Mm-hmm.
when you were coming up with your program, obviously someone who's had that sort of pain, how did you develop that, knowing that that can trigger
Yep.
some
I love
irritation?
this question. This is kind of a high level question. So I did not like doing it myself because you and I have similar spine situation, and extension was always tough for me. And surfing involves the pop up, which is kind of like doing Cobra, but in a more abrupt way. And so that always irritated my spine. And the purpose of having that in the program, and it's essential, is that when we have, everybody's going to have a limitation. You have back pain, you're going to have a limitation somewhere, right? And the tendency is to avoid those triggers, those limitations that if I do that, it's going to trigger my pain. And then I'm going to be back 2 more weeks of a flare up. Right. And if we continue to avoid those over a long period of time, it's going to have a negative impact on us. We're going to lose function. We're going to lose abilities. Our body is going to actually change and adapt because that's what bodies do. They evolve to the way that we use them. And if you're avoiding a certain movement or doing aberrant movement patterns because you're avoiding something, the body is going to change, for lack of a better term, is going to change its shape. And that's going to be an abnormal thing. And so what we really need to do is, and this kind of sucks, we need to go towards our limitations instead of avoiding them. But we need to go towards them in a smart, healthy way, because the reality is you need to be able to lay flat on your belly, and you need to be able to get a little bit of extension into your hips. You need it for something as basic as walking to be able to walk healthy. You need to be able to get some extension in your hips. And that's what we're doing with the front anchor, is we're bringing you towards something that is kind of scary, but doing it in a healthy way that's not going to hurt you. And the alternative is avoiding it altogether, which, like I was talking about before, is going to create other issues elsewhere. And so, and this doesn't just apply to back pain or just hip extension or just this specific context. Any injury that you have, if you are consciously aware that you're avoiding certain things, is probably not the best thing you could be doing. The best thing you could be doing is going towards those things, but very gradually in a like a mindful way, that you're training your body to be able to do them again and do them better. And I can relate it to any joint in the body. You need to be able to have a full range of motion, or it's going to change the way that you get in and out of a car or the way that you do something. And over a long enough period of time, it does create abnormal movement patterns. And your posture is simply just a result of your patterns. So it's going to change your posture. And so, yeah, the front anchor stuff, it's actually not, to get specific to your question, it's actually not training lumbar extension, which really with a spondy, you need to, whatever level your spondy is at, is that 5S1 most commonly?
Yeah, I don't remember if my L4, the L4 disc is really degenerative,
Uh-huh.
but I don't remember if spondy is, I think it's L5.
It's typically at L5S1, especially for golfers. I can talk to you about why. But if you have a spondy at L5S1, you really need to lock in that level. Like that level, kind of like the something kind of like broke. It's not a fracture, but something kind of like gave way. And so you
Mhm.
have like a little bit of a hinge there, like a door. There's a tendency to have a door hinge at your L5S1. And so we're going to apply the concept I was just saying to your issue. So you're now what you have to do is you have to avoid lumbar extension. And so if you avoid lumbar extension for the rest of your life, you're not going to irritate that door hinge. Great, fantastic. But guess what is also happening? You're not getting any extension into L2, L3, L3, L4, and L4, L5. And those segments are now going to lose the ability to extend. And then when you do have to extend because your grandson or your son threw a ball to you and you have to reach to catch it real quick, that's going to cause trauma to your spine because now you have 4 segments above your door hinge that can't extend for you because
Mm.
you've been avoiding it, right? So what do we have to do? We have to learn how to extend through our lumbar spine and go towards it. And we need to really, ideally, what you would do is you would train extension into L1 through L5, but not L5S1. You would learn how to lock that in with your pelvis by either posterior tilting, squeezing your glutes. And then the gradual approach is, all right, well, maybe I will do some Cobra, but I'm going to go up one segment at a time and I'm going to learn how to extend through these other segments that probably weren't doing it for me. So that's Cobra, and that's your extension example. In the program, we're not actually trying to get lumbar extension with the front anchor stuff. We're trying to teach hip extension, which
Yeah, that's what I was
everybody
going to say. It's
needs,
got to be hip extension
and
that you're working on.
thoracic spine extension. And so we are training you to kind of try and stabilize that lumbar region and get the extension as your legs are coming off the ground to go through the hips. If
Because that's
that
what you do when you walk.
That's what you do when you walk, right? You got to get that extension through the hips. If it's not going through the hips, and believe me, I would say 80 clinically, I'd say 80+% of people who have chronic back problems lack hip extension. It's like one of the magic keys that if you could get more of, it will help your spine. It's just really hard to get improve hip extension for what we talked about before the podcast, because there's a rope attached to your hip to your lumbar spine. So when you go into hip extension, it's yanking on your lumbar spine.
You've got it. Yeah, you recently, I think I don't. I was watching some of them on the drive. My girlfriend drove for a little bit. I don't know. It was a few days ago or a few weeks ago. You had a very very good video on YouTube
Yeah,
about
yeah, with an
the
animation.
psoas.
Yep.
Yes, that was great.
Yeah, that'd be a
Help.
really helpful video for anyone that's
Mm-hmm.
struggling with back pain to watch, because it's going to explain that connection. And so we have to learn how to really stabilize our lumbar spine for hip extension. And so that's what we're trying at a super fundamental level trying to do with that module 2 front anchor stuff. Learn how to get hip extension, but not let it collapse the lumbar spine. And
Well, I
so
think that would. I think again, doing it on the floor gives a stability that it's not going to go in where you're not going to lose that stabilization of
yeah,
L5S1.
the floor is helping you.
Yes,
The floor is
it's
helping you.
holding it there. That it's not going to go into position and
So
move.
the floor is sort of a crutch, which is not really a good thing, but what it's allowing us to do is develop the familiarity to learn, what does it feel like to move through my hip? and not my lumbar spine. That's what it feels like. All right, I have familiarity with that movement. I've been practicing it for a few weeks now. And so now I'm going to get up off the floor. I'm going to take the crutch away. I know the feeling and I know how to engage my core. We're going to apply this and we're taking the crutch away. It's a
Mm-hmm.
big leap to do. And you probably remember that. It's like, oh man, the anchor tryout is when we get off the floor and you're like, this feels like a complex thing to do. But with repetition, it just becomes like you get familiar with it.
Yeah, it is. It gives the brain, says that the rib flare did. It gives the brain a direction to go because of the feeling that it established. So,
Mm-hmm.
like you said, it is a crutch. But we also, when you break your ankle, you get something done to a leg. You have to walk on crutches for a little while to understand or give it time to heal and have a sense of how you're supposed to move, and then you can slowly work into it. And that floor gives that stability that it's not going to let you can't push the floor away from you.
Right. Yeah. Stability and biofeedback.
Mm-hmm.
Yeah. And that's a big one too. So love the floor, man. I think everybody should get down and just make friends with the floor at least once a day. I think that's one of the things, back pain's obviously a, a big problem in our modern day society. And I think that's just one of the factors of many that we're just not as familiar with the floor as humans used to be. And so it'd be a good thing to just consciously decide, like, yeah, just, start my day on the floor or at some point, get down on the floor and just make friends with it for a second.
Yeah,
So,
definitely, it works.
but so I mentioned earlier that there is a connection between, I brought up L5S1 and why it's most common that we get our issues at L5S1, and most spondies are at L5S1.
Mm-hmm.
It is the lowest segment of the spine. It's carrying the most load of our upper body weight. So that's a major one, but there's also another little thing about it. So I mentioned earlier that the lumbar spine isn't anatomically designed for rotation, and that's because of these little facet joints that they're like little arms, and they kind of like block the rotation from happening in the lumbar spine. But in the L5S1, they're slightly angled differently that allow a little bit more rotation. And so what you have is this segment of the lumbar spine that doesn't really rotate, and you have this pelvis that doesn't, the pelvis is a bone, so it's not, it doesn't really rotate. You can rotate through your hips, but your pelvis itself doesn't rotate. And so this segment between those two, L5S1, is like the weakest link in the chain for rotation because of that slight anatomical difference that allows it to rotate a little more.
Mm-hmm.
And so that's why a lot of the forces go through that joint, and that's where most degenerative problems in the lumbar spine happen. There's most movements happening in the L5S1, and is wearing down quicker. And so it just becomes even more important for the muscles to be doing the job of trying to stabilize that for things like a golf swing or lifting weights. If our anatomical structure is such that is making it a little bit of a weak point in the body.
With that, because one part of the program, your program is stretching, and if we alluded to your video on how the psoas and the flexors can get tight. But what I think most people do, and I'm guilty of it, so I'm not pointing the finger at everybody. I'm just bringing it as a point that most people do is, oh, I've been either sitting a lot or playing a lot of golf, or I've been in the gym a lot, so I need to stretch, get really deep into my stretch because that's what I see them talking about on TV or in the latest magazine or wherever they got their information. But your stretch is to get, at least what I took from it, correct me if I'm wrong, is to get the body to have some range of motion that is designed to have, but not go so far that you're going to destabilize. Because as I realized in the last couple of years, as I tried to get deeper stretches, my spondy really got irritated. In
Yep.
other words, the stiffness was there to protect an unstable joint because the muscles that are there aren't doing the job. So the other areas around it have to pick up the slack. And if
Yep.
you stretch too deep, then you can really set yourself off. It can be a bad thing.
Yeah, yeah, yeah. So we can talk about how, the body's tightening up the muscles on purpose, right? And so if the body's doing that to maybe protect a vulnerable joint, then stretching would ultimately be undoing that. And you could argue that it's causing the body to be more vulnerable. And so there's that whole concept, but also at the same time, body tightening muscles, trying to protect a joint, affecting the way we move, our comfort. We have to have some level of ability to stretch, or you're just like, we're not just complete victims to what our bodies want to do. We want to be able to have some control over that and manage our own body. So how much do you stretch? I personally, the way I look at it is stretch for function. Don't stretch just for the sake of stretching. So what amount to stretch is determined by range of motion. How much range of motion do you need in this joint to be able to function in your life? Are you a person that just really just needs to get up and down the stairs, get in and out of car, do the most basic things, and you don't really actually need that much range of motion. But if you're a golfer, you're going to need shoulder range of motion. You're going to need hip range of motion. You need to get really good hip rotation, both internal and external. It's going to be external for one hip and internal for the other hip, I think, right? But
Yep.
if I was a golfer and really looking out for my body, I would do the same for both sides. And I'd even do, maybe I wouldn't golf switch, but I would be maybe mimicking a golf swing in the gym switch, just to restore balance. And that's a tangent I don't need to go to, but get your muscles long enough to do the motion that you need to do. And that's
Hmm.
how much you stretch. Because if you're going to do it on a golf course, you better be able to do it in slow motion in the gym under control. And that's how much to stretch. But don't stretch muscles just for the sake of it. Why are you stretching them? Ask that question, then go, well, that will then tell me how much to stretch, because I need to get through this amount of range in my joint.
And I think most people, your average everyday person who plays golf for enjoyment, they play maybe in a league once during the week and then on the weekends with friends. But most of the time they're sitting either at a desk or driving or whatever, or a combination of the both. That just a simple stretch that is, I don't remember what module it is in the program, but that you have, but it's just where you're kneeling and you're just kind of getting your posture to be very vertical, and before you even lift the arm, so that the knee that is in front of you, I'm sorry, the knee that's behind you, it's stretching that, the
Yeah.
hip flexors on that side.
Yep.
Before you even have to reach that side arm up in the air, it's like
Yeah.
people will, to try to get themselves just vertical. I think many people have a very hard time.
Yeah.
That you don't need to get on the ground and do like a pigeon stretch with the
I
trail
love
leg
this.
fully extended.
Yeah, I love this. This is the equivalent. We're doing yoga again for an analogy of going to a yoga class, and you have two ways to approach it. You try to do everything that the way the teacher did it, who is, by the way, a professional yogi,
Hmm.
or you do the pose to the a degree that it feels appropriate for your current level of fitness. And that's the way that I recommend. And so, yeah, you want to feel into every stretch, and not just do, like, there's the same idea, but not just stretch for the sake of stretching. I'm not going to the yoga class to do the pretzel pose for the sake of doing the pretzel pose. I'm going to the yoga class to feel through. I guess I'm like 30% way through the pretzel pose, but this is about where I think I should stop. And so, yeah, doing stretches mindfully is really what you're talking about. And I think that's the way to be able to stretch and not hurt yourself. I don't know who else is going to tell you when to stop. Nobody else can feel the feelings.
No, and as you get older, as I've learned the hard way, which seems to be my MO, you don't make yourself like it. The old adage, you got to push through it. You got to push through it. I think when you're young and you're playing sports or you're doing something, you have to learn to. The push is more mental because it's getting out of your comfort zone to reach levels that you didn't think. And if you're not going to make yourself uncomfortable and get into an area mentally or physically that you're not used to, then you're not going to grow. But I think once we get to a certain age, the pushing now starts to work in reverse order, where you can push yourself to where you're going to damage something. And obviously, if you're getting my age at 50 plus or even older, let's say even 40 plus, because you're not going to recover as fast, you start pushing yourself, you're going to hurt something that now you're out of the gym for 4 weeks, 12 weeks,
Yeah,
longer. Now what's now you're trying to gain because like if you have $100,000 you invest it and you lose 50%, well, that's 50,000. You got to gain 100% just to get back where you started.
that's right. That's
And
right.
if it is for those of you who aren't there yet, as you age, and if you hurt yourself, you're out of the gym, whatever, or if they're doing just your program, just some basic stuff, and now you get a flare up. Now you're taking 6, 8 weeks off. Now you got to go that much longer, then some, just to get back to ground zero. And that's a very hard lesson to learn.
Yeah, setbacks are costly. Yeah, and learning the hard way is really what we kind of all have to do at some point with setbacks, because there's really no other way to learn where the threshold is than
Mm-hmm.
going past it. And so the best way to deal with setbacks is to take them as a learning experience and go, okay, that's where my threshold is or was at that time. And like even go to the extent of journaling about it, like, and taking a note, like, all right, like, this is what happened to me this time when I did that. And I got to build myself back to where I get to this point. But when I get here again, I remember, okay, like, I need to take the gradual approach and do the 1%. One of the themes of the program is 1% improvement, because that is, I still think people need to experience setbacks, but that is the only other way to make progress and learn where your thresholds are, is the
Mm-hmm.
1% improvement. And so having the patience, oh man, that takes a lot of patience, because you're right. We all want to exercise the way we used to when we were younger. There's a certain amount of nostalgia that we want to get to by doing that. Oh man, I wake up early in the morning, hit the track the way I used to, or whatever. And whatever it may be, that's the desire. But we have to fight that with patience to improve more slowly than we used to be able to. And still 1% per day after 100 days is a pretty good amount of improvement, right?
Yeah, I call it, myself and a few friends of mine, we call it farmer strong. And that a farmer cannot afford to get hurt or sick
Right.
or anything, because now he can't tend to his farm. And but he's doing it every day. And pretty soon, like some of the guys at the gym we used to go to, we used to call them farmer strong, because these dudes could just lift and lift and lift and do it crazy amounts of weight. But they had done work, because it's very agrarian. If you get 10 miles from my house, 5 miles from my house. So these guys grew up on the farm, throwing hay around and working outside and everything else. And it was obviously they couldn't do it to a point where they got hurt. They knew, okay, I need to back off, just instinctually, to say, because I know I can't cross this line. If I do, it's going to hurt the family. It's going to hurt our farm. It's going to hurt the
Yep.
business. So they know where they can't cross, but they go up to it every day, every day,
Yep.
every day. And
Yeah,
they
they
just
get
get so
pretty good at
strong.
knowing that threshold, and farmers, they're pretty tough. I think sometimes they do get hurt, but they're still working through it. So that's the way to really learn is they don't have a choice.
Mm-hmm.
Some of us do have a choice. We can stop playing weekend pickleball for 6 weeks, but they got to feel that pain every day.
But and like we talked about earlier, surfers, runners get the runners high. Surfers, you're outside, you're on the way. That's I haven't done it. I was always too afraid growing up in the '80s. Watching Jaws, I was always so afraid to go in the ocean. I'd love to surf, but I'm so scared. I mean, going through a barrel to me would be the ultimate.
Yeah,
That'd be
yeah.
so cool. But I'm just so scared to get out there in
It's
the
hard to
ocean.
describe. I think golf and surfing have that in common, that you're in nature and it's beautiful and you're in the zone and you lose track of time.
Hmm.
The playing field is always changing. You're not on a tennis court. It's just got these elements that make it hard to describe what's so addictive about it.
Yeah, that I think the golf thing, just from doing it for 4 decades, is it's a game against yourself, or it's
Hmm.
it is when you're doing it, you don't get lost, off on some tangent. But the golfers get very passionate about it, and they will sit out there for hours on end hitting golf balls to their own detriment,
Hmm.
whether physically or mentally. They wear themselves out both, and then they got to take time off, and then they recover, and then they go out there and they do the same thing again. And you have to, as a coach, you have to coach them back. Like what is your goal? When you came to me, your goal was to get from a 20 handicap to a 9, single digit. So what you're doing is not getting you there. Let's go back to what you said you wanted in the first place, what the beacon was.
Yeah.
But it's a they're very passionate, regardless of skill level. They call it the golf bug. Usually by the person's second, third year, they're out there and they can't wait to do it again. Doesn't matter how good or bad they are. And I tell some of them, they say, just want to break 100 and I'll be happy. I say, no, you won't, because then it comes up to 90, then 80, then 70. It never ends. So
Yeah.
it's a continual thing. But I can imagine surfing. I want to ask you, as a surfer, having instability in your spine, that how do you avoid the irritation? Because obviously on a surfboard,
Yeah.
you're constantly having that vibration, that bouncing.
Yeah.
That's got to sometimes just set you off. And
Yeah, it's really the paddling and the pop up, because you're having to be an extension. You're paddling. Unless you want to be nosing your board, you got to be extended to look forward. And
mm-hmm,
then the pop up is just like an abrupt extension. And so I got to deal with this all the time. But the way I do is I do a pretty serious routine before I paddle out. You won't catch me going surfing without first getting down on the sand. I'm on the shore. I do some bridging. I do my little routine. You basically would know it just by having done the program. I go through some of that stuff, lengthen my hip flexors. I really activate my glutes, and like that just opens up the front of my hips and allows me to do a pop up without it, the yanking on the lumbar spine as much. I'm also trying and conscious of trying to get the extension to go through the thoracic spine. So I do a couple things on the shore for that too. So it's the preparation, and then uh, trying to have conscious body movements is really hard when you're in the zone. You're having to react to a wave. You could probably compare it to golf in the sense that there could be so many things going through your head, and a
that's
really
for sure.
important golf swing, right? I watched that Netflix series. What was that called?
Full swing.
Full Swing. Yeah, I mean, I
I think
love that.
the third season's coming out, I think, next week,
I'm
this week,
excited
next
for
week.
that. I really liked the first season. I like the first. I don't know what the general consensus is, but I like the first season better than the second season. Although I really enjoyed the second season too. But just the intensity of the mental side of the game was really apparent in that
Mm-hmm.
series. I'm excited for season 3.
Yeah,
So
gonna be very interesting.
anyway, in surfing, it's having to react to this wave moving underneath you, and the timing, and you have to have like really good timing to be able, when do you pop up, how hard are you paddle, you got so many things going on. There's not so much pressure as it is in golf, but there's a lot you have to focus on. And the last thing people are thinking about is like body mechanics. You're just trying
Mm-hmm.
to get up on the board and stay balanced, right? So it is a challenge for me to try and stay focused on body mechanics during surfing, but the prep beforehand, I'd say, is the biggest factor for me.
You think that's why the having the correct feel of where your body should be through the exercise in the program is so important? Because if they have the feel, the more you ingrain that, develop the neural patterning, that the more
Yep.
you're going to be reaction. It's going to be it's going to follow your reaction when you get into your sport.
Yeah, I think that's the ideal goal. When you talk about muscle memory, it's essentially what we're going for is muscle memory. And so we want healthy to be our dominant pattern of movement. That's a hard thing to do. I think that the reality, like I could stand here and say, "Oh, it's going to be your automatic movement pattern by the end of the program," but it's not, because life goes on, and you don't get to a destination like that.
Mm-mm.
You just have to keep going on the journey of striving for being fit, just like any kind of fitness. I have to continue to strive to move healthy, and I do things that are bad for my body, like go on long car rides and sit at a desk for too many hours in a day. And then I have to pay the price. But the one thing that I will say that you get from the program, besides relief, the thing that's permanent that you get from the program is the confidence that you know what to do now. I know how to manage it now. And I know I'm not going to be in a wheelchair like I used to fear that I was going
Mhm.
to be, or have to go under the knife. So that just gives an underlying level of confidence that you have the tools and you've done it before and you can do it again, kind of thing.
It's like having a healthy painkiller is the best way I can
The
explain it.
side
You know?
effects are
Yes.
are different than other
Where it's like,
painkillers.
yes, it's like, okay, I know I've had an injury or I don't want to have an injury. I'm going to do this exercise. I'm going to do this program. And it gives you another avenue to say, okay, if I start to feel like I'm going down the wrong path because I recognize this pattern my body feels again, or I feel like I'm moving in a way that I know is not going to be healthy if I continue this way, it gives you the tools to help curb that and get you back on track, or to say, okay, I need to take a few days off or a week off or something, and do these exercise again to get me back to where I should be.
Yeah,
Now
reset.
I can go back to it.
Yeah. Yeah. It is funny, the healthy painkiller. I love that. It's like I've had to say multiple times that I pretty much have to stay kind of fit for the rest of my life. Otherwise I'm going to suffer, and that's
Hmm.
not such a bad thing. I don't really mind. It feels good to say that, but I don't really have a choice at the same time.
You got to deal with the hand that you're dealt on that one.
Yeah, I mean, I can get a little bit of dad bod, but there's a certain amount that I can't go past.
Another thing golfers are very big on that I think is working against them, at least as I talk to some world class experts like yourself. They're big on inversion tables. And I know you have an alternative to that. And I don't think that you're a big proponent of inversion tables either. Can you
Yeah,
that
inversion
part?
tables are just too unnatural for me. I don't have an aversion to them because, some people say they're dangerous and stuff like that.
For
I
putting
think
too much strain on the ligament is what I'm understanding.
yeah, so that is a thing for sure. Especially someone with an instability, and it could be in any joint. You could have, an unstable knee because you've torn your ACL a couple times or whatever. Are you sure you want to hang on that ligament? Because that's not really the goal here,
Mm,
you know. And so with somebody with a chronic back issue, most chronic back issues, spondy is a perfect example, but most are going to fall into this category where it's excessive wear and tear on the ligaments of the spine. A disc is a ligament, and there's other ligaments too, and they're breaking down because there's not enough support for the spine. That's what's happening. You got a herniated disc, you got a bulging disc, you got degenerative disc disease, you got stenosis. Essentially, you're having breakdown of your spine because of excessive wear and tear on the ligaments. And that is how you describe hypermobility and instability. You describe it the same way. So we're in this umbrella term of, let's call it back pain syndrome, and it's just like your ACL or your MCL. You don't want to hang on those ligaments. And so the problem with an inversion table is it encourages passive hanging. And when you hang passively, you're not hanging on your muscles, you're hanging on your ligaments. And so my alternative is the traditional form of hanging, is dead hanging, or like, how humans probably did a lot more of like climbing trees and stuff. Like, this is the functional way that humans can hang, and you can do it. It encourages more active hanging. Muscles are engaged, so you're hanging on a supported, musculature and spine rather than just passively hanging on the ligaments. And so hanging from a pull-up bar, or whatever thing that you find in your property, or a tree branch or whatever, I've also found that it really becomes a good training ground for core engagement too. And I'm
hmm
just becoming more and more a fan of active hanging. It's a way to decompress the spine and train under a decompressed environment, which is like triple win right there. And so you get to train without that compression and impact on your spine, and also get the same benefits that you would get from a inversion table.
Well, that was one thing I noticed was even after 3 months of doing the whole program, that when I did get to the latter uh, courses, I'll call them modules,
Yep.
as you refer to them, when I did the hang, that I did not have the either the strength or the everything was not set more in stone. Maybe that's a bad way. You want your body set in stone, but it defaulted to old patterns as I hung. It
Yep.
didn't keep its stabilization. And I'm like, okay, now it's not as, I know I'm better, but I obviously I'm not to a level where this is going to go through another level of load and then be able to maintain its stability. So I'm not to the, I'm, my confidence might have gotten a little away from me and that I wasn't hurting and I was moving better. But when I did it hang, I noticed it didn't get through that level of stability. So
Yep.
that was the next level for me.
Yeah, it makes perfect sense. I would expect that for anyone. It happens to me too. So, anytime we are adding or turning up the intensity, it's going to expose weaknesses. It's going to expose the things that actually we want to become aware of.
Mm-hmm.
You can deadlift with perfect form up to 100 pounds, but you throw 150 on there, you're going to expose weaknesses in your form, in your posture and your support. So that's essentially what's happening to your core engagement by having, now these ropes are getting pulled on. The rib cage has other ropes attached to it that are pulling up on it, right, when you're hanging. And so you're having to resist that now with the abdominal muscles. And I think that it's a good thing to become aware of the things that are being exposed in a controlled environment like that, so that we can then work on them.
Yeah, another level is exposed. No matter how good you get, it's like you just got beat down again. So go back.
Yeah, you can always add more weight. You're, no matter how strong you are, you can find your weakest link and you can work on it. It's just, for me, it's about deciding how far do you want to go down that path. Like, I have limits where I know what I want to do with my life, and I'm not actually going to just bodybuild for the sake. And you said I found another similarity in our stories. You said you started weightlifting pretty heavy at a young age.
No, I didn't weightlift young, and I was skinny as a rail. But once I got into weightlifting, I would say I was probably in my mid-20s once I got into weight training
Okay.
for
You were a little
obviously for
later than
sport.
me.
A little later, but I got into it gung ho, and I did get into some heavy lifting.
Uh-huh.
And then when I got into the deadlifting, because that was the thing 20 years ago that was making the push in golf, was the Olympic lifts, because you want the ground reaction forces to improve. You can hit it longer, you can push in the ground, et cetera, et cetera. And then obviously through the people I've had on here, and other back doctor, Dr. Richard Geyer has been on. I asked him, I've asked every back specialist I know, what do you think of deadlifts? And they say for golf, I said, yes, this nothing more than, let's say, 100 pounds, because the risk reward is just not there. That there's many alternatives that you can do for golf, people who want to play golf for a living in particular, or you want to play golf at a high level, or just you want to play recreation, you want to hit it better and longer. But the risk reward for back problems, spondy being one of them,
Yeah.
that putting massive amounts of load, bending over in deflection,
Uh-huh.
and then trying to lift multiple hundreds of pounds off the ground is a recipe for
It
disaster.
makes sense. That makes sense. So I started lifting, I fell into bodybuilding when I was 13 years old. It was a long story, but I started lifting heavy weights. I was in 7th grade, and just personal trainer I got introduced to was a bodybuilder, professional bodybuilder. And so by 16, 17, I was bulked, and it wasn't because I needed that I played basketball in high school. It wasn't because it would help me surfing. I was just doing it. I don't know why I was doing it. I guess,
That's another sport
looks,
that gets addicting.
teenager, girls, whatever, and I do think that played a huge factor in my early onset of back problems. It accelerated that whole process. And so that was the mistake. And I was referring to now is I'm not going to lift just to lift. It's going to be for a purpose. Like reverse engineer your goals. What do you want to do with your life? Okay, what kind of training then should you do to be able to do that better?
Mm-hmm.
And so that's really a good, for me, just kind of like guiding philosophy.
I agree. It's like, I don't remember who said it, but whatever exercise you're doing, if you're doing it correctively or you're doing it to improve your sport or your life, it should have uh, it should be the anecdote or the medicine for what you're trying to improve. It
Uh-huh.
shouldn't just be out there to, if you want to deadlift 400 or 500 pounds or more, okay, that's great, but you're not going to be you're not gonna be able to pop up on a surfboard. You're not gonna be able to have the pliability to hit a golf ball 300 plus yards.
It
And
doesn't
you're
sound
definitely
like medicine to deadlift that much weight.
No, you're definitely not going to do it every other day or Monday, Wednesday, Friday. You're trying to pull up 400 or 500 pounds off the ground.
Yeah. Yeah, I think there's been a lot of changes over even in my since I went to PT school and what they teach. And if you go back just even a couple decades, just the understanding of body mechanics and what's the best thing. And you could compare it to like nutrition, like how much has nutrition changed since the
Hmm.
90s, right? We thought we knew best, and that was what the science told us, and it was completely wrong, a lot of the things in the 90s.
Okay.
And so this happens with the body and body mechanics too. And I think that what everything's pointing to now is specificity of
Hmm.
training. If you want to get ground reaction forces for a golf swing, then you're going to be training something extremely similar to that, just in a more controlled setting in a gym, probably in slow motion or doing emphasizing certain moments of power generation rather than doing a full swing all at once. You're going to break it down and you're going to train that moment of the swing. And so it's not whatever your training is not going to look that different from the real thing. Specificity.
It's very interesting you bring that up. Dr. Tyler Standiford, who's a professor at Utah. I can't remember the university there. It's a doctor. Please forgive me for not remembering. You're only on a couple weeks ago too, but he does a lot of consulting work with a company called Smart to Move, who in the golf space is the leading ground reaction force measurement system. They have dual force plates and they can do it in 3D. And what he is part of his latest research that we discussed when he came on was the ability for like eccentric loading or eccentric,
Yep.
not
Yep.
X. I always get that wrong. Eccentric.
Yeah, it is right.
And most training, I think, was taken from bodybuilding or Olympic type lifting, going back to the Russians and the Bulgarians in the last century. But the eccentric load would be a 10-second lowering of the weight. That would be your training. Then you'd have your spotters lift it and you do 10 seconds. What he's found out as far as increasing and improving ground reaction forces was doing a 1 second eccentric
Oh,
to get, as you said, specificity towards the sport or activity you're doing, in this instance, a golf swing.
yep. Yep. Yeah, that makes sense. You're getting more similar to the timing of a golf swing.
Mm-hmm.
And then the other type of training that you would probably want to do is cross training or counterbalancing the repetitive nature of whatever you do too much, you know? And so you can look at some things for that. And so, yeah, if I were a golfer, I kind of already can envision the things I'd be doing. I'd be training. I'd be training for lumbar spine stability, transferring of forces through my lumbar spine, right? To have efficient energy transfer. And then I'd be doing cross training. I would probably be in a gym with a cable doing what looks like a golf swing switch.
Well, I think the Palloff press is a
The
common one.
Palloff press is a fantastic exercise.
Yeah.
I was actually thinking that one. That one's training lumbar stability,
Yes.
right? You're resisting rotation in the lumbar spine and very applicable to a golf swing.
Yeah, very interesting stuff. One thing I wanted to ask you as we get close to winding down, golfers in particular, as we talk about all these things that you want to have, that just the setup of the golf swing goes contrary to. So it's very easy to get kyphotic in golf, which limits
Yep.
the thoracic
Yep.
extension and rotation. It's very easy to get lordotic, where as we talked earlier, the common thought was to get the pelvic anterior tilted, even raised up, and now you're putting that strain in the lower back more excessively. To now it becomes inefficient, as you said, distributing load and torques throughout the spine. But do you think that it's not so much the golf swing? Is it what positions that the golf swing tends to over time lead people to do and how they're setting up? That it's not so much. I mean, obviously, I don't want to. Someone's out there probably rolling their eyes, saying, "You understand the forces and torques throughout the body?" Yes, I do understand that. How ridiculously high it is for that 1 second of the golf swing.
Yep.
But what I'm saying is, if the body, if the setup position of the person lends itself to getting 1 degree, let's say a month, more towards a position that it's not supposed to be in to be efficient and won't move how the body's supposed to move, do you think that that could be more of a causation than just the swinging itself?
That's a really good question. I think that for me, it's gonna be hard to separate the two because there's always multiple factors. I don't think the setup is gonna be the the number one cause, but I don't think the swing itself is the only factor either. I think that, if you talk about setup, like what were you doing to set up before you went golfing or the night before you went golfing? A lot of people were probably either sitting at a desk or in a lazy
Mm-hmm.
boy chair. That's set up too. So there's so many factors leading into it that I personally just don't like to point at one thing. And I do, but I will say, yeah, that's a factor too, So it's a lifestyle. Getting out of back pain or preventing back pain is a lifestyle change because you got to look at every area.
Would you say that? Would you have an opinion on? Do you think that back issues are more lifestyle oriented or genetically oriented?
That's a fantastic one. So the genetics, you can't argue. There's going to be more people that are more prone to back pain than others. So 100%. Are there people who have a genetic predisposition to back pain that can avoid it through lifestyle? I believe so. So I believe that lifestyle plays a big enough role that you can change the course of your destiny, for lack of a better term, and not and prevent back pain when the blueprint said that you should get it.
Mm-hmm.
Because what they know about genetics and DNA is we get a lot of different blueprints, and there's a lot that never gets activated and the environment is what activates the DNA that's in our blueprints. And so you expose yourself to certain things in the environment, your genes are going to go this direction. And so, yeah, if you do all the right things, I think you can stay out of back pain. There's always going to be outliers and exceptions, but I'll say nearly no matter what you were given. But there's always going to be exceptions to any rule.
Yeah, I think that the first time I had heard about that, and I think it became more prevalent, or at least out there in the ether, whether it's online or videos or what have you, was the old notion was that if you're, let me preface this, what I'm about to say with, yes, there are genetic predispositions for things like cancer, like the BRCA gene in women with breast cancer. And there
Yep.
are certain predispositions for certain diseases, heart disease and so on. You can also, as you mentioned, certain things will trigger the genetic coding
Mm-hmm.
that will open that door or not ever open it. And the first one that I really saw brought to the forefront was diet.
Mm-hmm.
So if your parents were of a certain generation and they ate, and I know I'm just gonna use examples. So anyone out there listening that's in the nutrition world, because I know those people go absolutely crazy on each other. If golf people and therapy people argued, that's nothing compared to the nutrition industry.
Yeah.
Let's just say that they ate, we'll say, a lot of fried food, a lot of smoked food, things that wasn't considered a healthy diet, drank maybe a lot of alcohol, smoked, etc. Their one of their parents or a family member died of a heart attack, and they said, "Well, I might have a predisposition for a heart attack," but they ate very clean, a lot of vegetables, a lot of clean protein, things like that, and then they lived a very healthy life. So I'm with you that it's your lifestyle is going to open or not open doors that are going to set some things in motion that are either going to be healthy for you or they're going to be detrimental.
Yeah. Yeah. I think you can relate back pain to a diet too, because, you know,
That the inflammation out of the digestive tract that's pushing backwards because there's only so much room in all of us.
yeah, well, what I was going to say was more the lifestyle aspect of a diet because, you know, the people that do the temporary diet to lose weight and then they stop doing the diet,
Mhm.
it's going to come back, right? We already know that. So to if you want to lose weight or make a change through diet, it has to be a lifestyle change. You have to become the person that you actually want to be. And so that's what it is for back pain too. And I think lifestyle does play. For me, it's the only thing we have control over. So it's 100% of the problem and 100% of the solution. And your genetics, we don't really, you know, the only control we have over it is lifestyle to help control those genetics to be the best ones that we can.
But for somebody out there who's listening, who luckily doesn't have back issues and they're active and they want to stay that way, and somebody who's a father, you have one child and you're ready to have your second. What are things that you'll implement with your kids to try to ensure their best odds of not getting into the position where they have a lifetime where they have to modify their style around their injury, or for somebody out there listening who has avoided injury, what would be the advice that you would give that type of person?
Well, one just funny quick thing is that my son, who's 1 and 10 months, so 22 months, he's already bridging a lot just because he's seen dada bridge. And this is for people listening, this is one of the main tools that we use in core balance training for restoring muscle imbalances and just training the core. So I bridge a lot, and he started doing it. So that's not wasn't a planned thing, but you know they're copycats. So I think he's already on a good track because I think the bridge is one of the best exercises you can do if you do it the right way. For just we talked about cross training, all the sitting that we do in our life. It's the closest thing to the opposite of sitting, and I just want to give like a warning to anyone like you it's really important to bridge the right way, so you can hurt yourself if you have an existing back issue by doing the bridge. So it's not just like inherently a great exercise, it's something that you can use as a tool the right way to be good for your body and your back. So that's cool for him, he's already bridging. But I would encourage him to think about his body and his life when he's choosing a career, just instill healthy habits in general. Is there really, actually, you're kind of stumping me here. It's a question I've never thought about. The question is, how am I going to raise my son to not have back pain, right?
Or yeah, or to put into place some things that will limit the percentage or the probability of him having back pain.
Yeah, maybe not put in some things. So I think like video games is pretty hard on the posture of young boys when they should be
Hmm.
outside. So I would probably try to encourage him to be outside and not just, like, for the parent that's like, I should buy my kid a video game because I think they will like it. Don't do that. Please don't do that,
Or the common one I hear is, well, at least I know they're in the house and they're safe.
Yeah.
It's like, yeah,
Yeah.
there's a lot worse things that.
If you live in, Compton or whatever your equivalent of is a really dangerous part of a town, maybe that's true. But otherwise, if you're talking about long-term safety, mental health, physical body health, I think being outside is the safest place to be.
Mhm.
So yeah, I think that's the big picture answer is get outside, because you're not going to really spend a lot of time in a C curve rounded posture if you're outdoors.
Yeah, you wouldn't. Yeah, you couldn't perform if you're
Yeah.
stuck in that position. And somebody, let's say that they're, let's say 40 or in their 40s, and they're, that dead zone where they're usually parents, their career, they're really working a lot, but they still want to remain active, or even a retiree. Is there that either want to avoid, or they had a little scare, maybe they had a little tweak in their back and they had to take a few weeks off, and they don't want to do that? Is there any And I don't like to speak in generalities, and that's one reason that the podcast is long form. I can't ask an expert like you to come on and speak in generalities,
Yeah.
or in short form. It's like, well, what the hell's the point? You got so much in your brain that even in long form in a couple hours is not
Yeah.
enough time. Anything that your advice that you have seen in your practice and with working with people that might not be in a book, a textbook, but you've seen over time and say, I'm having a theory on this, that if people did more of this, then it might, as a general rule, be very helpful to the population at large.
Yeah. I think the three main things would be walk as much as you can. If walking doesn't hurt, you should be walking as much as you can. And that's one of the most just posture balancing activities. It just uses all the muscles in the body in a synergistic, healthy way. So for some people, their back pain has gotten to a point where walking actually hurts. And I can make sense of that. But so that's not somebody I would say this to. So it's somebody where walking doesn't hurt your back, at least. If it hurts your knee, that's a different story. Put a knee brace on and walk. But for your back, if it's not hurting your back to walk as much as you can. It was our human locomotion design, and cars and bikes and whatever else weird futuristic machine that we're using to get around now was not part of the design.
Mm.
So do that. And the other one I already mentioned is getting down on the floor more, no matter how old you are. Actually, there's so many other benefits to getting down on the floor. A lot of women, as they get older, have wrist problems because they have issues, is just weakness in their wrists. Getting up and down on the floor prevents stuff like that. There's just, you could probably write a textbook on all the benefits of just getting on the floor more often. And the things we talked about earlier are a lot for, specific to the spine, the biofeedback that you get from laying on the floor, the firm surface allowing like the muscles to just relax and the rib cage to get a little movement of that pressure. We're not getting enough pressure from laying on your mattress on your bed to like
Mm-hmm.
just gently spread those ribs and move them and just get like some blood flow in the crevices of your joints of your body. So that would be number two. And number three, I think, would tie into these is education, just learning a little bit. And this would be self exploration, like not going to some get a degree or go to some course somewhere, like just like out of your own interest to learn about what's inside there, the pelvis and the spine. And just even if you just like, this is why I think the animation YouTube video that you mentioned earlier is doing so well, is because people get to see what's happening in their spine when you go to stand up from a chair, and we all do that, and so it relates. And so just educating yourself a tiny bit about the anatomy and how it moves in your body, which will then tie into you walking more and getting down on the floor more. And it's all a positive feedback.
Yeah, it's a positive loop that just gets you moving more, because the opposite is not an option. Because that, I mean, we're all going to end up in the same place, but it's how we get there, how we age gracefully. And are you able to enjoy your life as opposed to just sitting there with a remote control in your hand, pissed off because you have no dopamine, no epinephrine release because you're not active, and it's just a
Yep.
vicious downward cycle. That do these things, get core balance training, and go through the 90-day program at a minimum. You might not be able to do the advanced things, but at least you'll be introduced to the things that we're talking about right now, and that you can get started on that path. It might take, like, if you're really twisted from a lifetime of banging your body up like myself, it might take you longer than 90 days. So stick with it, but it will get better.
Yeah. Yeah. I would say that for a lot of people, it it does take longer than 90 days, but then there's a lot of people who don't even finish the program because they got what they needed.
Mm-hmm.
And pain is a big motivator to do things you got to do. But I think a lot of people, they end up getting out of pain at some point, and they just move on with their life. And that is really the ultimate goal for me, what I set out to do. So I don't have a problem with that either.
Yeah, because if they're gone, if they flew out of the nest and they're good and they don't ever come back, that's kind of what the purpose is of
Yeah.
putting this out there. But if they do come back and they're coming back multiple times, then it's like, hey, you might want to stay through the whole program and then continue
Yeah.
with the alumni program, because you're obviously coming back and there's a reason for this. And if you want our help, we're here to help you.
Yeah. I think it does uh, help. You mentioned you keep going back to the beginning stuff. I think it does help, and that is the most valuable stuff in the program. It really is. And you can create modules 2 or 3 through. I think module 3 and 4 are pretty good too, but you can create module 5 through 12 yourself just by applying those early modules to whatever you want to do. And,
Mm-hmm.
the ultimate goal is as we're kind of wrapping up is, we know that there's a predictable pattern that humans we're going to get old and we're going to start closing down. Look at an old person's posture. It's hunched forward. That this is a flower blooms, opens up, and then closes back down, and it dies. Right. This is what we do too. And the goal is for us to stay open as long as possible. And the things that we do in our life influence that. If you're sitting too much, you are putting yourself in the posture voluntarily that we want to avoid as we grow old. It's the same posture.
Mm-hmm.
And so if that's not that's for me, that's the motivation, is to get up, move around. That's what you're going to hear from any expert out there. It's pretty simple. Get up and move around. We sit too much, and it's going to keep your posture open. It's going to keep you moving healthy, and it's going to just prolong the closing down that inevitably happens to all of us as we age.
Well, we touched on a lot. I mean, did we leave anything out? It's amazing how we blow through 2 hours.
For me, I mean, I could talk just like this for 3 days straight. So we probably left some things out, but
What's a reason for you to come back? We'll have you on again. Most definitely.
yeah, I'd be happy to come back. And I think if people walk away from the episode with one thing, it would just be these final messages that we're touching on, is like, it's the big picture stuff, and you can break things down and under a microscope and in the science of it all, but it's all going to come back to, what are you doing with your time?
Mm-hmm.
And that's what your body's going to start to look like if you're doing
Yeah,
that
your
enough.
habits. What are your 5 biggest habits that you're doing with your time? And you're
Yep.
going to start to resemble that. You're
Yep.
sitting 10 hours at a time. You're sitting 8 hours at work, then you're sitting, let's say, an hour in your car ride home, and then you're sitting at dinner table, then you're going to sit and watch TV. I mean, that's 16 hours a day.
And what you just described is incredibly normal. It's
Unfortunately, that's the new
expected.
norm.
But it wasn't part of the design. And so, I think as a society, as a culture, for us to get healthier, we probably need to start going back towards some things of the past. Anyway.
It seems to be the same, whatever field is in nutrition, as we talked about
Yeah.
a little bit, that nutrition is going back to eating more natural,
Yep.
real food instead of processed food. Meat, that we don't even want to go down that,
Yep.
with the fake meat now. It's like Jesus Christ, people, you're eating fake meat and you think that's healthier than the real thing. I mean, I got to sit there and scratch my head at some of this stuff.
That's a really funny way to put it. I totally
It's
agree.
amazing. But yes, everything seems to be coming back around. It's like I sometimes sit there and wonder and scratch my head and say, Jack, just imagine how far society could be if people just gave some serious thought to some of the things that they're doing. And just take a step back and look at your lifestyle or say, okay, I have this wrong. Where's the pattern that has gotten me to this? Like, oh wow, geez, every day I'm sitting and I'm looking like I'm 80 years old and I'm only 50, or I'm 46 or whatever, 36. It's hard, but it's not hard, because people, we're so conditioned to do the same thing. And
Yeah.
your stuff is
It's
simple, but
not
it works so
easy.
well.
It's simple, but it's not easy.
Yes. Tell everybody where can they find you? Where can they follow? They want to reach out to schedule an appointment with you. What's the best way to do all
Yeah,
that?
I mean, I think that you probably mentioned the most helpful library is the YouTube channel, and good place for people to just expose themselves to ways, some concepts about the body that could be really helpful. And there's the free trial. There's probably enough in the free trial for everyone to get an idea if it's going to help and or not. And I think it gives you enough to just make your own decision. I think that is why it's kind of really just a great. I really like the way it's set up. So those are the two things. The YouTube channel probably has some links on it to take the free trial.
And your website, the 15-minute video on the masterclass, I think, does a very good job of explaining in that short a time a very broad scope of your whole program.
Yeah, yeah, yeah. So that's on corebalancetraining.com. So you can find that.
Okay. And obviously, as everybody knows that follows the show, if you're new to the show, that will be in the summary. One-click link to Dr. Ryan's page, have links to all your social media. And anything else that you want us to get out there, we're happy to do it.
I just want to say thanks, Pete. It's been a real pleasure. Yeah, I really enjoyed the conversation, and I'm definitely going to be tuning into the podcast. You're a great interviewer.
Thank you. Just if you hang out for a minute, everybody, thanks for checking us out again. We'll see you next time.